first, let's talk about the issue of health care and the notion that Bernie Sanders raising taxes on the middle class is going to be disastrous for the middle class. He answered this question in a way that I think was brilliant. Let's take a quick look at that.
The first thing I hear about you is that you're going to raise taxes on the middle class. I support my family on a salary of $41,000 a year. I'm wondering, if you raise my taxes, how does that help me?
What we are going to fight for is a Medicare for all single-payer program, which would provide comprehensive health care to your family and every family in America. So let me tell you what we do. We raise your taxes if you're somewhere in the middle of the economy, about $500. But you know what we're going to do for health care? We're going to reduce your health care cost by $5,000. So you're going to pay a little bit more in taxes, but you're no longer going to have to pay private health insurance premiums. Now, I've been criticized for this, but I believe that health care is a right of all people, that we should not have these deductibles and co-payments. We should not be paying the highest prices in the world for prescription drugs. And our Medicare for All program will guarantee comprehensive care to all people and save middle-class families some thousands of dollars a year.
Chris, let me just ask you, does that math work for you?
I mean, if it saves me on health insurance premiums, I will gladly pay more taxes.
See, and Chris, what happens in politics, I don't want to shock anybody in the office, sometimes people distort things. And I've had 30-second ads run against me years ago. Bernie is going to raise your taxes. But they forget to say, we're going to do away with your private health insurance premiums.
So I thought that was a great moment for Bernie, because he got the opportunity to explain that, hey, you know what, in the long run, or actually in the short term, I'm going to save you money. My favorite line was, I'm going to tax you $500, but I'm going to save you $5,000. Now, those aren't exact numbers, obviously, but it explains what his plan is. And just juxtapose that to the way Hillary handled the health care question. Hillary handled it by talking about how she doesn't want to repeal the Affordable Care Act, making it seem as though Bernie Sanders wants to repeal the Affordable Care Act. He's not planning on doing that whatsoever, right? And so her framing is frustrating me, because she's making it seem like Bernie Sanders is going to come in and undo all the work that, you know, liberals have been able to do in terms of health care. His healthcare policy, in my opinion, is a good one. And I like that he had that moment to kind of explain that raising taxes incrementally on the middle class is not going to be that big of a deal.
I like that he was able to, I mean, look, it's not that the words he used and the way he delivered it was amazing, but it was probably my favorite minute and a half of the town hall, because it's so important. And it seems like one of the major strategies that the CNN, MSNBC recently have been using against him, to the extent that, and I do believe that they don't want him to be president, is that they want to just keep saying he's raising taxes. Just say that he's raising taxes. It doesn't matter about who he's raising taxes on, or if it would be offset by more money they would save on something else, and we can quibble about what the actual numbers would be. They just want to say he's raising taxes. And his ability to easily explain to someone how that isn't actually the case is important. I was impressed with the guy's response, because usually an undecided voter has been following one of the candidates for for a year on Facebook. They're not actually undecided, but he seemed to actually be willing to listen, which was important. And I don't understand why Anderson Cooper, well, I do. I know why Anderson Cooper wouldn't say this, but she keeps implying that he would go in and propose Medicare for all. And to do that, you have to first destroy the ACA, and then hopefully you win that fight for Medicare for all. And if you don't, oh my God, we've just lost all of our health care, which is 100% untrue. How can you allow her to keep going out and implying that? I think that people watching this think he will destroy Medicare and then try to get something crazy and extreme from the Soviet Union.
Okay, so I'm less comfortable with the single payer proposal than you guys are. Well,
don't worry, it's not going to happen apparently.
Right, no, from an economic point of view. So why I find that answer somewhat disingenuous is the fact that it's not quite a simple trade-off. Let's remind ourselves, he hasn't done and I don't want to sort of turn this into a bashing session, but I just want to give a little bit of perspective, and I feel I just want to put that out there. Even by his own estimates, is going to cost an additional $13.8 trillion over that 10-year period, right, from 2017 to 2026. Right?
That number is so
false. That's from his.
I understand that.
Side,
that
right?
is the cost of health care over that period of time.
Right.
It's not additional spending over what gets spent. It's just that this money is being spent to the government as opposed to private health insurance.
Okay.
It's not $13 trillion in new expenses are invented.
Okay. All right. Let me go about this a different way.
That is implying that the government would be taking care of all of the health insurance costs over that more than a decade.
Let me make a different point, a slightly broader one then. Nobody knows. The costing of it hasn't been done, right? So whilst the concept of socialized healthcare is admirable, the proposal in terms of a single-payer system, Medicare for all, which is in and of itself slightly disingenuous because Medicare, you do make contributions. Under the current Medicare system, you do make contributions. He's proposing there's no contributions
Yeah, I don't think it
that
should
are
be
made.
called Medicare
And there are
for
no.
all.
But anyway, leaving that aside, no one has done the economics of this. So for him then to say, and it was legitimate, but for him to then to say, well, it'll cost you $500 in taxes, but I'm going to reduce it. It just. I think whilst conceptually, obviously, it's admirable, and the healthcare system in this country, coming as a European coming to this, it's just baffling to me every time I come into it, so I applaud the sentiment, but the economics haven't been thought out at all, and he would perhaps be the first to say that because even it was a 4-page paper that he put out, right? That didn't go into any of those numbers. And I just feel as though
Republicans insist that you only use 2 or 3 pages of paper from now on.
Every bill only needs to 4 pages max.
Yeah.
And from the commentators and the critics that I've read, it's the implication would be that there would be not only wouldn't be just a like for like, so there would have to be an overhaul insofar as how doctors would be charging, how hospitals would be run, so from the top down.
Yes.
That is so fundamental. Not that it doesn't need to happen, not that it's not laudable. I'm not saying that.
It absolutely
but it is so
needs to
fundamental,
happen.
right? It's so fundamental that again I just come back to this. Listen, no one's going to cry over drug companies not making as much money. No one's going to cry over insurance companies not making as much money or just being completely disbanded. But when you're talking about the way hospitals are run, all those workers, or doctors taking home less money because they will be able to charge less, there's a kind of like a domino effect expanding out, which that kind of an answer, I know it's a town hall and you have to give a sort of soundbite answer, doesn't really speak to. So for me, that's why I had reservations about the neatness of that response, because it isn't a like for like, I'll take $500, but I'll save you $5,000.
I'll go a little further, and I can't get into the numbers because there's no way I'll ever understand them. But I know this. I know that every time in history when a politician has said, you pay $500 for something now, I'm going to take $500, I'm going to give you $5,000 back, it's not true. In the history of the world, that's never been true. Not one time. I don't think Bernie Sanders is the first guy to get it right. There are plenty of liberal economists who say his plan will not work without raising the tax rate on the richest Americans to something closer to like 85%, which is where you start to maximize revenue. Kenneth Thorpe, this is from Jonathan Chaitin. Maybe Jonathan Chaitin, the New Yorker, is one of those people, establishment people who's determined to take down Bernie. I doubt that, but maybe he is. I don't know. I am always being told that I'm missing out, and this guy's a part of the system. But he says that Kenneth Thorpe says it's completely implausible. The Sanders campaign has called Thorpe's estimates a complete hatchet job, so there's a disagreement there. But there are serious people who say that that's not true. All of that, to me, holds up to what Hillary says, which is it's an irrelevant conversation. There's not going to be a political revolution yet. You want him to be the first stage of that revolution, that, as John points out, that if you don't strive for the revolution, you'll never get there. But we're not getting a Democratic Congress in the next 2 things, unless something I don't know about at all happens. So we can continue.
Campaign finance reform.
Right. I mean, there's something, right, campaign finance reform comes, but that has to be done then we got to redistrict also, which is currently in the state legislature. So we'd have to have Democrats win on the state level, get to the 10-year mark where we redo the, come on. We're 2020 by the time we can make any significant dent in redrawing congressional districts and have campaign finance reform. I'm not talking about aiming small, but if we're going to get into the minutia of his health care plan, he's not passing it. He's not passing it. You're right. Hillary is she is misrepresenting his point of view, and that should be pointed out that the ACA is not going away. I disagree with you. I don't think anybody believes that. I think we're fighting a fight from two people.
When she says start from scratch, you don't think that that's intentional?
I think she's running a campaign. She's trying to beat him. She's trying to beat him.
She is
You don't
trying
think
to beat
that she
him.
chose
No
that
one's
based on
disagreeing
focus
with
groups
that.
to imply
I
to
don't know whether
people?
I don't know how well they focus grouped everything. I mean, I think they think no. First of all, there's not everything's focus grouped. A lot of it is just it's guys.
I think starting from scratch has a very specific meaning.
Well, I doubt it works very well. And on healthcare, his numbers have been catching up to her, and she's been synonymous with healthcare reform in this country for 22 years. And so she had a big lead, and he's cut into the lead on that. So I think that these are two people who both believe in strengthening the Affordable Care Act. And he would go farther, but he's not going to be able to go any farther. As we've just seen, Barack Obama wouldn't have been able to pass it if he hadn't expended all that political capital in the beginning of his first term when he had a Democratic House and Senate. This obviously, it would I think we can all agree, it would never have passed with the Republican majority in either house.
But didn't Obama have certain influences behind the scenes that impacted how hard he fought for a public option?
He didn't fight hard for a public option.
He didn't fight at all for a public option.
He made a deal. I mean, we can debate as to whether he believed it in his heart. I hate those conversations. I don't know. My hunch is he did, but who cares? Whatever, it doesn't matter. The deal he made was not to have that, and it barely passed. And so I don't know. Again, would a leader with his political capital who had fought for it might it have passed anyway with a public option? Yeah, I don't know. I don't
think that you can pass something as revolutionary in a country like the United States, like the public option, if you're not a fighter. Obama was not a fighter. Okay. He campaigned and made it seem as though he would be one, but as soon as he was elected, the concessions began, and he immediately started taking back some of the things that he campaigned on. So Bernie Sanders doesn't strike me as an individual who's weak.
No.
And a lot of these candidates...
I don't think she does either. But
she might not be weak, but I don't see her as someone who's going to fight based on principles as opposed to someone who's going to fight.
I just want him to fight. I don't care about the principles. But I hear you. I know a lot of people do. I really don't care. I don't care if she lies. I don't care if she's dishonest. She's a president. She's not my principal, right? She's got hard things to do, and I think it matters.
I get that she has hard things to do, but what I'm saying is principles do matter, and if someone is willing to put her principles aside or his principles aside in negotiating with Republicans that have no interest in negotiating with them and working with corporations that have no interest in changing the status quo, I have no interest in that candidate.
Well, first of all, I think we have to draw some distinction, and I got put in my place by a friend of mine on this too a little bit, but there's some difference between bad-mouthing corporations in general and bad-mouthing Wall Street and banking in general and the financial sector.
Or like Walmart.
Right.
Whose board she served on.
Well, corporations, I got it. Corporations are going to be part of this government and going to be intertwined. They're not people, but they are who employs people. So that's a rhetorical device that I think we should all be careful of, but maybe you don't feel that way. But Wall Street and the financial services is a different beast than just corporate America. Corporate America,
definitely.
What, right? Don't you think?
Well, there's a million corporations in this country, and
some of them are great.
A small number of them, yes.
But you got to give, I think, don't you think it's fair to give, I got it, he didn't fight for a public option, but he did pass a bill that was revolutionary. I mean, the Affordable Care Act was revolutionary.
I got it. But I feel like, especially when it comes to the Democratic Party, there's a lot of pressure to just be happy with a little bit of change and a lot of weakness from our candidates. And I'm tired of that. I don't want weakness.
I don't want weakness either.
Exactly.